So today we're going to be talking about the risk factors of coronary artery disease. If you have your worksheet handy, at the top it says CAD. CAD stands for coronary artery disease. So you can go ahead and write that in. We're going to be talking about 11 risk factors today. And the first 3 risk factors are risk factors that you cannot control. First one is age. As you get older, your risk increases. Men over 45 and women over 55 are at an increased risk of coronary artery disease. Women have a higher threshold, probably because of estrogen can be a protective agent, and at 55, the estrogen levels decrease for women. Number 2 is gender. Again, men have a higher risk than women, and estrogen is probably one of the factors. And the third thing is heredity. If you have blood relatives who have had coronary artery disease, which would include heart attack or stroke, before 55 if they're a male and 65 if they're a female, it puts you at an above average risk. So it's really important to understand your family history. If you've had people in your family that have had coronary artery disease or heart-related problems. However, it's important to point out that these factors neither condemn or protect you. For example, my dad had double bypass surgery, had coronary artery disease before the age of 55, which puts me at a higher risk. However, my dad also smoked 3 packs of cigarettes a day and was not in real good shape. So while, yes, I do have a higher risk, since I don't smoke or have those kind of risk factors, it doesn't necessarily mean that I will have coronary artery disease. Now we're going to talk about risk factors that you can control with how you live your life. I wonder if you could guess what the number 1 preventable cause of heart disease is. The number 1 preventable cause of heart disease, we talked about this in class, is obesity. This risk factor just became number 1 in the last 2 years, overtaking smoking as the number 1 preventable risk factor. Why is obesity linked to heart disease? Well, for every 30 pounds of excess fat, the heart must pump to 25 miles of extra blood vessels. So you can understand the strain and stress that puts on your heart. Excess fat can increase blood pressure, which we'll talk about, heart rate, and just the increased stress on the heart. Fat tissue is alive and it has blood vessels that run through it. So that's why the added stress with the added fat comes in. Therefore, doctors are now saying that sitting on the couch eating junk food is now more deadly than smoking a cigarette. Not that we're advocating smoking a cigarette, but just to put that into perspective. So then number 5, smoking has moved down 1. So it's the second most preventable cause of heart disease. Smoking kills more people each year than AIDS, alcohol, and cocaine combined. It increases your blood pressure. It increases your heart rate. It increases the chance of lung cancer and coronary artery disease. Smoking is extremely addictive. Some experts say as addictive or even more addictive than heroin. Best advice, don't start. Now, the next risk factors are not necessarily in order of, preventability, and they're all very closely related. So number 6 is high blood pressure. The first bullet point there, it's also known as the silent killer because there are a few warning signs and symptoms. There are many people that walk around with high blood pressure and do not even know it. It's also known as hypertension. Hyper meaning high and tension meaning pressure. And we're going to talk about that in just a second. So when you go to the doctor's office, they always measure your blood pressure. You should ask the nurse, what is my blood pressure? This is a reading that you need to know. 120/80 is what is considered a normal reading, although some doctors would say it is a high normal reading. 120/80 is the systolic and diastolic pressure in your heart. Systolic, the top number, is when your heart is contracting, and 80, the diastolic number, the bottom number, is when your heart is at rest. So having high blood pressure can damage the components of your circulatory system. And then this next slide, I'm going to show you how that happens. So this is a picture of an artery that has plaque buildup inside of it, what we would call the coronary artery disease. So what happens is when this plaque builds up in the artery walls, it creates a smaller space for the blood to flow through. It also causes that artery wall to become hard and less flexible. All of this creates a greater tension in the artery wall, which weakens that over time. So when that artery wall becomes inelastic and hardened, it's more likely to be damaged. It's kind of similar to an example that I would give is like if you're trying to drink a milkshake and you get a piece of ice or ice cream caught in the straw. It's so much harder to get the ice cream or the milkshake. So it just you have to create a tension. You have to create more pressure in the straw to get it to your mouth. And that's what it's like when you have high blood pressure. Number 7 is high cholesterol. Again, very closely related to high blood pressure, can cause high blood pressure. So that's why I'm using the same picture. This cholesterol is that buildup in the artery wall, the predominant fatty substance in the plaque. So it's all this stuff right in here is the cholesterol plaque. So there are 2 types of cholesterol. It's really important for you to know. There's HDL, which is called high-density lipoprotein. Lipid meaning fat. And the way I remember is HDL, H being healthy. And then the other kind is LDL, low-density lipoprotein, which I remember L being lousy. So when you get a cholesterol reading from your blood, like they would draw blood and do a test on it, your cholesterol should be collectively below 200. And usually you will have that broken down into high density and low density. So you want the high density lipoprotein to be high and the low density lipoprotein to be low for that to be healthy. Cholesterol can be improved with diet and exercise and also medication because there are certain types of high cholesterol that are hereditary. Number 8, inactivity or sedentary lifestyle. So your risk of having a fatal heart attack is nearly twice that of an active person your age whose other risk factors are equal. So all things being equal, if you're inactive and another person has an active lifestyle, then that makes your risk twice that of theirs. We had talked before about, again, this is very closely related to obesity. And obesity is the number 1 risk factor that you can control. Exercise lowers your resting heart rate. lowers your blood pressure, lowers your cholesterol, increases the stroke volume of your heart, and increases the chances of surviving a heart attack. Number 9 is diabetes. Diabetes doubles your risk of heart disease. Now, there are 2 types of diabetes. Type 1 is what we call juvenile diabetes. And this is hereditary. This is the type that you're born with. So this would actually be a non-controllable risk factor. Only affects 10% of the population. So the type of diabetes that we're concerned with is called type 2 diabetes, which of those who have diabetes, that's 90%. Usually it's people that are overweight, and it is called adult onset diabetes. And this is caused by lifestyle. The good news about this type of diabetes is that it can be eliminated through diet and exercise many times. So the key to diabetes, or I should say type 2 diabetes, is diet, eating a healthy diet, fruits and vegetables, high fiber, and getting in 10 to 20 minutes of exercise a day. Okay, moving on to number 10, stress. How we manage stress potentially determines the quality and the length of life. So when you become stressed out, our body reverts to what we call the fight or flight response. And this is hardwired into us from our ancestors. If a bear walked into your room right now, your body would respond. You would either fight the bear or run away from the bear. So your body responds by increasing heart rate so that you can get ready to leave. Blood pressure goes up, sugar levels go up, blood clotting ability increases so that if you were to get injured, you would not bleed out. Vessel constriction to prepare your body for vigorous activity. The problem is that in our society, we are not fighting bears and lions and tigers, but we are fighting things like SAT scores, getting into colleges, grades, peer pressure, things like that, things that we don't physically fight or run away from. Therefore, if you are not physically responding to stress through exercise and it's not released, this causes physical problems and heart disease. So it's very important, probably without a doubt, the number 1 prescription for stress would be exercise. And then the last contributing factor to coronary artery disease would be drug abuse. The use of illicit drugs can have fatal effects on the heart. Many people die each year of heart-related complications due to cocaine use. Many times, this is a first-time user. So those are our 11 risk factors of heart disease. If I were to wrap it up, the best prescription to fight coronary artery disease would be a healthy diet and exercise.